Now to the growing crisis in our hospitals. As you may have seen on the 6 o'clock news, NHS services could be dramatically cut to save billions of pounds. This problem is arguably most acute here in London. And today came the news that two of our councils, Ealing and Hammersmith and Fulham, are now actively fighting cost-cutting plans that could close some of their A&Es. Our political correspondent Carl Mercer reports.
It's an emergency department that's made headlines for all the wrong reasons, but one that is starting to turn a corner. The North Middlesex has been heavily criticised in recent months for poor performance, but more staff have been recruited. Things are beginning to improve.
You'll have to do that every single day, and then
Matron Gemma Davis was one of those brought in a month ago to help turn things round. Issues here, she says, are similar to ones faced by emergency departments across London.
People will come to ED because they do know that they will be seen. They'll be seen by an emergency doctor, they'll be seen by emergency nurses, and we just need to get them the right people in now. So we need to see the sickest and the most unstable.
Turan Hussain is another new recruit, the new clinical director in this emergency department. The challenges here are common ones. More and more patients, a squeeze on finances and trouble recruiting staff. It also took on more patients when the nearby A&E at Chase Farm was closed.
I think that's a big question for the NHS as a whole. There's a lot of change required. We need to think of different ways of working, smarter ways of working, and that includes patients also in terms of how they access health care.
North Middlesex, like hospitals across London, will be part of new plans being drawn up by local doctors and councils about the next 5 years of the NHS in London. It's likely some of these plans will eventually lead to a cut in the number of beds and possible future A&E closures, which is why two West London councils have said they won't sign up to them. A long campaign has been fought against plans to downgrade the A&E at Ealing, with a similar battle just down the road at Charing Cross Hospital.
We're not prepared to support these proposals because we think that lives will be put at risk. People would have to travel much further to get to A&Es.
We will carry on talking to our partners and we'll carry on working with them on plans which will help people in this borough. But the part of the plan we cannot accept is that which threatens the A&E here, which threatens the hospital here.
The local health commissioners wouldn't be interviewed but said their plan
is all about local government and the NHS working together to provide joined-up services that residents in North West London need. The right local services are in place so people get the right care in the right place at the right time.
The opposition in West London may be a sign of things to come, with the capital as a whole facing a £3 billion hole in its funding.
In some places in London, simply meeting growing demands for care means they're having to struggle not to open new hospitals, let alone shut down beds that they've already got. So the challenges aren't any different in London, but as you say, they are acute.
The final plans for London should become clear in October. Carl Mercer, BBC London News.